The fact that we continue to have more and more conversations on mental health, the fact that you're having an event which is about well-being, and in itself is a movement. And I think that's the way we need to understand and appreciate that there is no way there is any health, anything where mental health is not there. So when colleagues from healthcare have preventive health packages and preventive health checkups, I wonder what makes them call them preventive health checkups. Because if you aren't checking for psychology, mental health, well-being, social wellness, then it's at best a preventive physical health marker checkup, if you want to call it. Because if you want to define health, try defining health without using mental, social, spiritual. Try doing that. You won't be able to do that. Yet we've gone through what we've gone through. Back in 89, I passed my 12th. I did not know psychology exists as a subject. When I was completing my MBBS, had not even thought about taking psychiatry. When I decided to take psychiatry, I remember my interview for the medical postgraduate seat. And I said, I want psychiatry. And the dean said, are you sure you want psychiatry? You are getting medicine. I said, no, I want psychiatry. He said, 3 mahina ma chhodi to nahi de. I'm from Gujarat. That in 3 months you will not leave and go away. I said, no, I want to do this. And in my 3 to 4 years in Civil Ahmedabad, I realized it kept on happening. You would have somebody joining and leave in a few months for this branch or that branch. But frankly, that just changed my perspective to what I was pre-entry into psychiatry and post. When I came back here, my initial conversations, I was told by a senior colleague at that time that, make sure you don't say no for basic medical issues, because people may think that, you don't have solutions, or you're not a doctor enough. I said, if I knew how to treat common cold, I would have taken medicine, but I have no idea. And I've not prescribed a paracetamol in my 20 plus year career. I'm a psychiatrist. All my MBBS knowledge is all gone and done with. So if you want to come and take treatment for common cold from me, God be with you, because I'll surely mess it up. That's not my expertise, and I don't want to feel bad about it. I know a bit of psychiatry, good enough. We're all students, life goes on. And I know absolutely nothing of anything else. And that aspect probably only comes once you are willing to accept what you know and what you can't know. Then as one moved forward and started career, and I remember the first organization I joined with, stayed with them for 11 years as founder member. The only slot they had for psychiatry at that time was a 2 to 4 p.m. slot, which apparently nobody comes. And they thought, okay, our room use ho jayega. And from there, as we continue to move forward, look around us. Now look at statistics about where we stand. Single largest illness in the world. Single largest illness in the world. Take a guess. Depression. 5% of the world's population. 10% of the global health burden. 10% of the global health burden is psychiatry, neurology, substance abuse. In the non-fatal disease burden, it's 30%. Look at the statistics. 700,000 people die of suicide every year. Every 40 seconds, we lose an individual to suicide. Every 41 seconds, a family loses a loved one. Facts. We've just about had a National Mental Health Act and a program which is developing. We are still amongst a few countries which still doesn't have a national suicide prevention policy, although it is very much in play. More than 50% of illnesses, 50% of illnesses have their onset between 15 to 19, which basically means if you don't focus on the schooling adolescent years, you have lost the plot in any case. Now, these are facts. Can't deny that. And before I come to the mental wellness aspect, one last fact for you. Rich nations have a ratio of psychiatry is to population at about 70 per lakh. Low income and middle income countries have 1 to 2 per lakh. 1 to 2. So we are in the 2 per lakh category. That population also of experts is largely in the urban semi-urban areas. So as you go in the length and breadth of our outreach, you'll have lesser and lesser experts available. So what happens is, we may do all the advocacy that we can. You may create all the awareness that you can. But if you don't have accessibility, what do you do with the awareness? And that's where problems happen. Faith healers. Faith has a lot of role. No? But faith healers as a substitute for illness is the issue. Faith is very much required. Our lifestyle very much required. Not a substitute, but it's like having water. If you need to have a good lifestyle, simple as that. But then what is lifestyle? Beyond exercise, beyond meditation, beyond... There are so many elements which you don't look at. And if we are willing to learn as a civilization, if at all we can be called a civilization, because I'm not too sure, because when you visit social media, it doesn't seem like civilization anymore. Because I feel that most people who are on social media probably never went to a pre-primary or a kindergartens where they were told, use language which is appropriate. Because we can't use proper language, then there's a problem. But then that's the world we live in. See the world from a 14-year-old's point of view now. A 14-year-old opens any social media page and there are lots of abuses, lots of stereotyping at all possible levels you can imagine. We in mental health have struggled with stereotyping and discrimination for generations. The work done by psychiatrists 70, 80, 100 years back is what a psychiatrist like me is able to speak today. Because what they would have gone through at that time, I can't even imagine. Where, the ward would be hidden, the OPD would be hidden, the entry would be hidden. I mean, I've heard these stories from seniors. So understand this aspect. Just look at from where we need to start focusing upon. So a 14-year-old sees an internet which is, you can do whatever you want there. Complete proliferation, intrusive, virtually no privacy. And when you are 14, you don't understand what privacy is and what privacy isn't. The kind of peer pressure that you go through, the kind of pressures that we have, the mere fact that we actually believe that more than one teacher for one subject will actually make you perform better is one of the most ironical components of modern day conversation I've ever heard in my life. Right? It's just unbelievable that it's like saying that, for the same thing, you should have two people. So basically, imagine, I'm very glad I wasn't born in this era. Because if you were born in this era, then in any case, they would have diagnosed me as ADHD and put me on meds and put me in a special school. Because I speak fast, I write horrible, I have dysgraphia, I can't sit at one place, I need to do multiple things at one time. So if I was born today, they would have put me in the special wing for sure. They wouldn't have had the patience to deal with me. And then just about managed to learn physics from one teacher. Imagine two teachers teaching me the same concepts. अब उनकी आपस में ना बन रही हो. अब you tell me which sporting event have you seen having two coaches? अभी एक कोच से दूसरे कोच के ट्रांजिशन में इतनी प्रॉब्लम आ रही है. दो कोच एक साथ हो जाएंगे तो क्या करोगे आप? ये बोलेंगे फ्रंट फुट पे आओ, बोलेंगे बैक फुट पे जाओ. Doesn't work. More is not a solution to life. Better is a solution to life. Effective is a solution to life. In any case, I've had an issue with the way we've allowed education to go through. I'm good. I'm 89 when I passed my 12th. We didn't have this need of extra classes and tuitions. School teachers were competent enough. In fact, what was trained to me by my teacher, my 12th class biology teacher told me something very clearly. Don't stop playing your cricket. Don't stop playing your guitar. Pad to lena. He trusted me with the fact that I was studying and reminded me that breaks are more important. That has stayed with me today. That shaped a career. And if I reflect on one more aspect of my school education, what shaped my career was my Hindi teacher. In grade 7, my Hindi teacher somehow realized that I can speak. And then he just made me speak. So you can wake me up in my night and just ask me to give a topic, but make sure that you tell me the topic before I start speaking, because the odds are I'll forget it. So I always have somebody who reminds me just before I start speaking and sends me a message that please speak on this topic. So how did this happen? Because you were able to value various components of life. How does the self form? सेल्फ की फॉर्मेशन कैसे होती है? माइंड तो तब आएगा, पहले सेल्फ आएगा. Self is formed when you recognize who you are, when you have meaningful relationships. Not number of followers, it frankly quite doesn't matter. And if COVID hasn't taught us that number of followers doesn't matter, I don't know what will teach us that. So followers doesn't matter, likes, views doesn't matter. What matters is, do you have somebody you can actually speak to, not text to? And I've been telling young people a lot, you want to take care of yourself, meet and talk, COVID appropriate behavior as long as it's here. Meet and talk. Otherwise, take a video call, then audio call, but no texts. And even if you are texting, can you please use words? And then people of my generation, हमें तो ढूंढना पड़ता है. फिर आपने पता नहीं क्या इमोटिकॉन भेजा होगा, पहले वो देखो, फिर उसका मीनिंग देखो, गूगल करके मीनिंग क्या हुआ, फिर समझो, फिर ये पूछो कि यार इसका जवाब क्या देना होता है. I mean, look at the hearts. What a generation. They will never understand the beauty of actually giving hearts. Strange color hearts are there. Heart which is beating, heart which are 3, heart which are 4, heart which is bandaged. God knows what these emoticons mean. And why are they even there? Reflect on what I'm saying next. How did language start? Illustrations, then words, then language, right? कभी तो हम भी caves में रहते थे, वो निशान निशान बना देते, यहाँ जाओ वहाँ जाओ. What are we doing now? Emoticons, strange abbreviations, as though you've never gone to a school. And what that happens is you will actually get a CV where you will be a you and not a YOU. And then I remember my English teacher, and you almost get a headache after reading that. That how is this even possible? Because it almost becomes automatic. You ask a young person today a question from your teams. If they'll not know the answer, they'll pick up their phone, Google it, give you the answer. They'll just give you the answer. They will not now realize that they still don't know it. Because this is an object. This is not a body part. Just because you hold it in your hand, it doesn't actually become a part of your body. But you actually falsely believe because it's always with you, and it is always with you, because there is so much on your phone that you always need it to be with you. And no wonder you need passwords and eyes and voice and thumbs and things like that. Because what if somebody else reads it? So in any case, your life is not going fine, if that's the case. Now, if you look at that, so what happens is that you gave an answer, no encoding happened, nothing went inside, no absorption time happened, it just went on the next one. That's how it happened. It just doesn't work. So if you want to look at mental health, let's look at a spectrum here. Solution of mental health is not expertization. Enough experts as a solution to mental health for a country like ours will take so much of time that it's never going to be a solution. So first, let's understand that. So what do? Look at life skills. Skills for life. How do you do that? Start with schools. Mental health curriculum in schools. Psychological first aid in schools, teachers, parents. Life skills. And digital media literacy in today's time, and I'm happy that we have a concept of well-being in the digital times. Please understand the importance of media literacy. Just because a website mentions that if you are below 18, don't enter, that does not mean that a below 18 does not enter. You have to presume the ulta. You just because you're saying no, it's going to be experimented. So you now think about how do you want to filter it, what do you want to do about it. So you use education. Media literacy is an absolute must. As you move forward, look at building peer networks, help young people realize the importance of relationships, parents, grandparents, cousins. That's what matters. That's what our actual roots are. In fact, when people have been asking me for the past several months to speak about the new normal, and I keep on saying there is no new normal. There was a normal. We lost it over a few decades. Just bring it back. What is the new normal? Spend time with family. We used to do that. We stopped doing that. Have meaningful relationships. Take me time out. Do a bit of exercise, eat well, spend time with people you like, invest in hobbies, do your work, restrict your working hours, so on and so forth. Work-life balance. We used to do that. So when I see my parents and that generation and their life, I was telling my dad, you're 80, there is no way I can reach that age. With the air that I've been breathing, and the water that I've been having, and the lifestyle that we've been having, point in here. So we need to value that aspect. And from there, you take the next step, which is what is corporate India doing? P&L, yes. EBITDA, yes. But if you do not measure mental health outcomes, then you are being unfair to your own self. So you just can't randomly talk about attrition and engagement. You can't randomly talk about burnout. What are you doing about it? Mental health outcomes has to be one of the criteria of measuring how any organization is doing, small or big. That has to be the case, because these are all preventive methods. These are all early intervention methods. Then you go to the next, which is psychological first aid. Nobody who's struggling is going to first go to a doctor only. In any case, there aren't too many doctors out there. They'll come to you, a friend, a colleague, a family member. How do you respond at that time? Psychological first aid is the key. We learn about CPR and we should. We learn about physical first aid and we should. But the odds of somebody in your life needing psychological first aid almost regularly is going to outnumber people needing physical first aid. So you do that. And now you come to the last segment, and that's where the family physician role comes. I fundamentally believe the solution to mental health lies in primary care, which is family physicians, primary health care. That's where you work. So the family physician is competent enough to say, this illness, you may need this doctor, or I'll be able to take care of it. Go talk to this counselor or therapist, or I'll be able to take care of it. So you create layers and filters, and then you add the experts. That's the solution. For this, help-seeking behavior needs to be there. How do you ensure help-seeking behavior? Conversations around mental health needs to be without stereotyping, without discrimination, and conversations around mental health should be a lot more. If 1 in 5 people in the world suffer from a mental ailment, and as per world data, what does it mean? How about 1 in every 5 posts you make in social media are on mental health? And mental health is not that you need to tell people what is schizophrenia, what is bipolar, what is depression. It is about spend time with your family. That's mental health. Take me time out. That's mental health. Go take a break. That's mental health. Switch off your phone. That's mental health. Help somebody. That's mental health. Be altruistic. That's mental health. And that's what COVID taught us. People who had positive vis-a-vis not positive outcomes during COVID, the difference was support system. So let's reinvent support systems. Humankind version post-COVID needs to be a far better version of itself by prioritizing mental health. Prioritizing mental health is not about experts. It's about individuals, families, social networks, everybody. You and I, all of us are equal stakeholders for mental health. Just because I happen to have studied psychiatry and happen to be an MD, that does not make me a stakeholder or the key person for mental health. I'm a speck of a sand. And that's the reality until all of us pull in our everything and become advocates of mental health. So these are the times where you walk the talk, but by talking. So you talk and then you bring it out in your actions. So if there was only one message for all of you, unmute yourself. Thank you.
Thank you so much, sir, for educating us on mental health and mental well-being. And now I would like to invite Preeti Singh, who is the founder Sattva Nation, sitting right here in the front row, to join us and lead on this fireside chat right here with Dr. Parikh. Welcome you, Preeti. Ladies and gentlemen, a round of applause. Let's keep those applauses coming in. In fact, the music today should be your applauses. Thank you.
Thank you so much, Dr. Parekh. It was really nice hearing your words of wisdom. And this is first time we heard of psychological aid. So I would request you if you could elaborate this a little more. Like, I know what is first aid, but then I don't know when someone is fighting depression, how to help them?
So what is first aid? See it like that. Let's say I fall down. You'll come. You'll see if I bruised, you'll put a bandage. If I'm having nausea, you'll probably give me or talk to somebody and give me a tablet. And then you'll say, okay, this is what is happening. Let me take you to a neurologist or let me take you to an internist. And till I'm there, you'll be with me. That was your first aid. Now let's put it in psychological first aid. Let's say I come and say that I am having low moods. So if here you say low mood कुछ नहीं होता, जाओ जाके walk कर लो, या वो आंवला खा लो, या थोड़ा काम ज़्यादा कर लो. So what you did here was you undermined my feelings, prevented me from speaking to anybody else also, and I almost felt it was my fault. The reverse would be you say, okay, what's bothering you? Let's talk. You help me talk about it. You validate. You give me compassion. And then the same you can say, okay, let's read about it or talk to an expert. If need be, let's go there. So this is psychological first aid. Like a friend calls you and says that I had an argument with my boss and having a bad day, I want to quit my work. Now when you intervene here and you talk to them and help them take a decision, maybe your friend may not quit job, may become a better worker, improve relationship because you provided psychological first aid.
Absolutely. Like you said, communication is very, very important. So, sir, I represent a holistic wellness platform called Sattva Nation, where we talk about the balance between mind, body, and soul. And mind plays a very, very important role in overall well-being. When we talk about holistic wellness, we always think of physical fitness first. So body comes in the mind first, but then what we had learned and realized, especially in last 2 years during the Corona time, and when I was listening to Mr. Luke, what we realized that mental health plays a very important role, not only improving your immunity, but also handling with the situations. We were never ready for the crisis what we have experienced, and depression is going to be the biggest epidemic what we are going to face in our country now. Now coming back to the life skills, you mentioned about adding life skills to the curriculum so that our youngsters, those who are so busy in the digital era, and all of us are so busy on our mobiles, and especially I have full sympathy with the young kids. They are studying on laptop and mobiles, and same goes with us. So, sir, could you please help us understand what are these life skills which can help me get cope up with these situations better way?
So, couple of things here. I personally feel that the digital interface and digital classes actually helped some percentage of our children to at least go through the year better, because it did give them a regularity, a rhythm of life. Although that percentage we all need to appreciate in a country like ours wasn't very high, because children who did not have access to net, so on and so forth, also is a reality of our lives, which sometimes people sitting here, all of us, may not be able to understand. Having said that, I think implementable aspects should be looked at. One, mental health curriculum. We'd written a mental health curriculum, I think 4 or 5 years back, which is where you train teachers 5 basic modules: understanding mental health, what is mental illness, how to increase resilience, how to reduce stigma and use right language, create a culture of well-being in the classroom. You do this for about 10, 12 years. There's a curriculum based on the age. Create that atmosphere. That's one. Then life skills, from assertiveness, social skills, communication skills, handling various aspects of creativity, problem solving. Then you add digital media literacy. I think media literacy is very important, that you don't get swayed by news. You ask yourself, is this a complete news? Is it partially true? Is it factually correct? From where is the source? Is the source reliable? Is the source who's speaking about is that person qualified enough or experienced enough to talk about it? So on and so forth. And to work on self, because sometimes media interface has a self impact on young people, whether it is body image, whether it is self-esteem, whether there is aspects when they see images and pictures of people. So that's where media literacy comes. And with that would also come working on bullying and cyberbullying. These are 4 very implementable aspects in a structured manner, which can be done across schools. But I think the initiative needs to come from all stakeholders, where schools and parents will need to realize that alongside a career where marks play some role, the non-marks factor of our life plays a much bigger role.
Absolutely. My eyes are completely stick to the timers over there. But I had 4, 5 questions. Now, cutting it short, sir, I'm going to make 2 questions at one go. Sir, we are discussing about mental health, but food is also a very important component of our overall well-being and health. And like in our first inaugural session, Luke spoke about importance of sleeping well. So how important it is for my mental well-being to have a good sleep and to eat good?
See, I'm both a Gujarati as well as a psychiatrist. So Gujaratis eat food. Yeah, you give me my jalebi fafra for a breakfast and you give me a bit of gotas in the evening, then I'll be very happy in any case. I look at it in 2 ways. I think healthy diet is important. There is nothing to talk about it. But I also feel the fact that to be able to enjoy is also important. You don't need it to become a preoccupation that you stop enjoying it. And if you don't sleep well, you won't function well. Goes without saying. Sleep deprivation studies have been there for decades. If your sleep will be less or the quality would be less, irritability, physical fatigue, immune deficiencies, your relationship parameters, your concentration at work, your human errors at work, all of that is going to be a sequela. So especially for people who sleep with their phone switched on, you're going to visit somebody like me very soon. So if you can just switch it off when you sleep, I promise you the world will not leave you. It'll be right there where you left when you'll switch your phone on. Maybe in fact, 1 hour before going to sleep, switch it off and just don't switch it on for at least half an hour. That is going to be the most beautiful part of your life, and the phone will not be with you.
But sir, it's easy to say, but then it's very difficult to practice when someone...
Try calling me after 7 p.m.
Wow, that's great.
Try calling me after 7 p.m. My cell will be off. Anybody who has my number, give it a try. It'll never be available. It's been 20 years. The world has not left me, and people who needed me were still be able to find me. And frankly, everything did not happen between 7 p.m. to 7 a.m.
Lovely, sir. So digital detox is very important in today's life, and especially when you mentioned about social media's impact on our mental well-being. Trust me, sir, I have been doing a lot of college sessions with the Delhi University colleges, even management colleges, promoting mental well-being and mental health. Now, these youngsters, they come up with questions like, our career is finished. We are finished. I said, what's the reason? They are like all 18 and 19-year-olds. They say, now we are not getting the jobs. We are not going to get those handsome pay packages what we were expecting due to Corona. So what you are teaching us is very important to not to get mesmerized with this fancy world of getting digitalized. Digital detox is very, very important. Now, जाते जाते sir, वो एक मूल मंत्र जो आप हमेशा अपने talk shows में देते हैं. I've been hearing your talk shows on TEDx and Josh Talks. What would be those 3 life skills and steps what you suggest to all of us to start practicing from the day one? Of course, you said after 7 p.m., try to switch off the mobiles, but give us 2 more.
One of my books has just come out. It's Alone in the Crowd. Well before COVID, this book we had actually completed. I'm reflecting on this thought. It just came to me while you were speaking. And then we didn't release it during that. We thought, baad mein karte. I thought about it when COVID was not even a thought process in any of our minds. And I wrote that because the common aspect of people coming to me was, and people started talking so much about urban loneliness. I mean, how oxymoron that is. In a densely populated metro, how do you find to be lonely? But we were. Because work, sleep, some party, something here, not the purpose, not the meaning, not the joy of being. And that's where a lot of loneliness started trickling in. And I think COVID has taught us a lot. So if I were to give you 3 takeaways, you will need to ensure that meaningful relationships has to be your top priority. We are absolutely nothing as an I. If I's don't become we, me will be lost and be lonely until there is an us. There is no substitute to people. And that is never going to be through texts and group chats. It is a one-to-one, person-to-person. There is no substitute to that. Second aspect, like I said, in these worlds of digital world, please find time for your own self. There's an absolutely wonderful world. I see young people seeing a sunset on the beach and they'll be clicking their own picture and not the sun or the beach. And I feel so sad for them. You spend so much distance reaching a place and you're clicking your own self. And frankly, that isn't as pretty as you think, because that is absolutely divine. So you do that and unmute yourself. Baat karo. Kuch hoye to baat karo. Unmute yourself.
Lovely. Thank you so much, sir. It was really nice having you here. And I would like to thank Dr. Anurag Batra for making this possible, that all of us are here together today celebrating the Festival of Well-being. So thank you so much, Dr. Anurag Batra. Thank you so much, Dr. Parikh. It was really nice conversing with you.
Thank you so much, Preeti, for that fireside chat and leading those wonderful questions. And I would request you to kindly hand over a small token of love and appreciation to Dr. Parikh here for being generous enough to share his time and wisdom with us. Ladies and gentlemen, a thunderous round of applause